Hey guys, Dr. Davin Lim, board certified dermatologist. Today we'll be talking about five super common things that most dermatologists see on a day-to-day basis that can impair, your journey to awesome skin. These are simple conditions or simple mistakes that we see all the time. And today I'll talk about 5 ways how to avoid these mistakes and get you on your skincare journey. So the first thing, makeup. So avoid going to sleep with makeup on. That's super important. You hear every dermatologist go on and on about that. Reason is being because makeup can be occlusive, and once you have occlusion, you can have acne, zits, pimples, blackheads, whiteheads. So remember, always take your makeup off before going to sleep. That's the first hint. That's really easy. Number 2, cleaning too much. Believe it or not. So you can go from the other way, where you don't actually remove makeup and don't clean, to the other end of the spectrum, you clean too much. This is especially important for patients with combination skin, so oily skin together with dry skin, or patients who have a lot of oil, and as a result, you think that you clean 3-4 times a day or 5 times a day, the better it is for your skin. No. It is well known that water itself can cause irritant contact dermatitis. So if you're using just water, you can irritate your skin. Most dermatologists advise that you should clean your skin maximum with twice a day. And the more you clean your skin, the more irritated your skin can get. The reason being is that you're removing your oil layer, and the oil layer is protective. The other thing is that when you clean too much of your oil off your face, you have this feedback loop. In other words, your skin detects that it has less oil because you're removing it all the time, and as a result, it kicks up production. So in other words, you're going to get more oil. So you've got to break down that loop and actually do sensible things like just clean twice a day. Now, the third thing we're talking about is not giving time for products to work. And imagine if you buy yourself a new skincare active and you go, cool, this is going to have awesome effect on my skin. It may, but it often takes at least 4 to 6 weeks, upwards of 3 months before things happen. Even with prescription grade retinoids, for example, we know that the positive benefits, for example, your reduction of wrinkles, your increase in collagen, your reduction in pigment, your reduction in oil production, they all take time, especially for collagen and wrinkles. If a product advertises instant results, chances are it's full of BS. The reason being is that your skin, anyone's immune system needs time to activate your fibroblasts, to produce collagen, to activate angiogenesis, in other words, production of new blood vessels. And that all takes at least 6 weeks, with maximum effects at 3 to 4 months. So if you're using a skincare active and you're not seeing results in that first 1, 2, 3, 4 weeks, be patient. The worst thing to do is swap your products, change things, layer things, and as a result, you go backwards. So if you find something, stick to it for at least 2 months. And the right way to do things is do what we do, is we take clinical photographs, because that way we can see the progress. So if you're looking, for example, pore size reduction or wrinkle reduction, make sure every single thing that you buy, make sure it counts, because if you're using stuff just for the sake of using it and you get a skin irritation, or it decreases your skin's threshold, that means you can't use another product to best effect, because all you're doing is you're layering things, and as a result, you will get some irritation. So be patient, be analytical with your skincare, and that's the biggest hint I can give you with that. Now, the fourth thing is using too much product. So remember, you've gone from too often or not giving it time to too much product. Now, the problem with using too much product is that they often have, or actives often have, interactions with each other. For example, a common one, retinol. So retinol, we know, can boost collagen. It can, like I said, it can reduce wrinkles, can treat acne, can reduce oil production. It can make your skin brighter, lighter, nicer. Problem being is that once you start adding other strong actives, for example, ascorbic acid or vitamin C, because of the nature of good ascorbic acid, it has very low pH, which means you're using a potential irritating, formulation, which is your retinol or retinoid. together with something like ascorbic acid. And what can happen is that you'll get a rash, or you can get an irritant dermatitis. So using too much stuff, there's a correct way to do things. For example, like your alpha hydroxy acid, you should not mix it with beta hydroxy acids, because your BHAs can abrade the skin, even though it's anti-inflammatory. You're using too many acids, and combine that with skincare actives in the incorrect order, that can cause a rash. So if you want to know how to actually mix things and which things are compatible, my Instagram link at Dr. Davin Lim can give you little hints, because I do a couple of segments each time every week, and that way you have a library on skincare tips, hints, and hacks. Now, the fifth thing that we talk about is sunscreen. So this is probably the biggest gripe that we have as dermatologists with patients, is that before patients learn how to use sunscreen, they go on other actives. So there's no point, for example, having an antioxidant. So you might invest in a really expensive antioxidant mixture, something with ascorbic acid, vitamin E, tocopherol, ferulic acid. And you go, cool, I'm investing in antioxidants, but the foremost is that you don't want to have oxidation in the first place. And the way we actually reduce or prevent oxidation or oxidative stress is to reduce the amount of UV. And the best way to do that is to use sunscreens. But 90% of people, of patients, do not know how to use sunscreens correctly. So if you're using a physical sunscreen, or even a chemical sunscreen, you need to apply the right amount. The right amount is between 3 to 5 mils. Yes, a lot of dermatologists say use that every 2 hours. That's impractical, So I think using it at least twice a day, once in the morning and once somewhere around midday or in the afternoon, that will be a good thing. So if just as a rough guide, if you're using the correct amount of sunscreen, 3 to 5 mils will last you approximately a week, So if you use, if a bottle contains 50 mils, and if you're using, let's say, 5 mils for your face, neck, chest, neck, that's basically 10 mils gone in one day. So you've got a 50 mil bottle, which is standardized bottle, that should actually last you 5 to 6 days at most. But look, realistically, most patients don't do that. I certainly don't do that with my sunscreen, and that's just being practical, because most of us use somewhere between 1 to 3 mils at most per application. So if you're going through a bottle of sunscreen once every 6 to 12 months, you're probably using a tiny, tiny amount. And believe it or not, the SPF rating of the sunscreen depends on the amount being applied. So if you use half the recommended dose of the sunscreen, you basically cut your SPF in half. So something like an SPF 30 is actually equivalent to an SPF 15. If you're using only a quarter of it, the ratio goes down. So remember, sunscreen use and how to use sunscreen correctly is paramount. Guys, I hope you like that short video. It's only a 9-minute video on things, but I hope these little hints can help you on your everyday journey towards awesome skin. More on how dermatologists approach skin in the captions below, or head over to my Instagram account, because I can discuss a lot more, as in a lot more in depth per item with Instagram compared to YouTube. I'll see you next week. Bye for now.